How are you?
Welcome back to another episode on RN Effect.
I'm JG.
And I'm JD, and we are so excited to be back with you guys on this video.
Yes.
Today we have a really fun topic, I think. It's a pretty prominent topic in the healthcare community today. And so, JG, what are we here to talk about?
We are going to be talking about the LVN role and the RN role.
Yes.
JD and I were sitting here having a conversation, and with everything that's going on with the pandemic, LVNs are transitioning back into acute care in the hospitals. And so I think that it's time for us to have a conversation about LVNs, RNs, and how we work together to have such good patient care, right?
I love how you frame that, because that is what it's about. It's about working together. So we're finding that the LVN is in high demand today. Again, to JG's point, because of the pandemic. So, the nursing shortage. So suddenly there's this big call and rise for the LVNs and RNs to join forces and get out there in our patient care needs. So JG and I wanted to talk about what are some of the differences between the RN and the LVN, and then how can they merge together to make the most impact as two nurses in the care team.
Right. I think that we should start with kind of like the basics, right? We know that as nurses, we start with assessment, whether you're RN or LVN.
That's right.
So what's the difference between RN and LVN when we do assessments, right? So let's start with the LVN role first. The LVN, as an LVNs collect the data and monitors data for assessment, okay? Once the LVN collects that data and is monitoring that data, they then take that information to the RN. At that time, that is when the RN will analyze the data and formulate a plan of care for the patient.
Yes, perfectly said, Jess. Yes. So, to JG's point, so what's happening is your LVN is collecting the data, right? So they're still doing assessments,
right?
But the way they're using their assessment data is a little bit different than the way the RN is using the assessment data.
Correct.
Is that right?
Yeah.
So the LVN is collecting the data and they're monitoring on a consistent basis, looking for any changes. So you're constantly assessing a patient. So you require the same assessment skills and competency as an RN, right?
Right.
But then the RN then takes that information to what JG was explaining, right? And the RN then is looking and analyzing and synthesizing information to come up with the plan of care.
Right.
One of which then the LVN is going to implement and continue monitoring through assessment.
Correct.
That's a big difference between the two that I think a lot of people are not clear on.
Yeah, I think so too. I think that sometimes we take assessment and think that assessment is just one thing. Assessment is not just one thing.
Such a good point.
It's a plethora of things that it takes both the RN and the LVN to do together.
Excellent point.
Yes.
Excellent point, Jess. I love how you put that. So some of the other differences between the RN and the LVN are some of the tasks, I guess, maybe.
Yeah. Right.
So our LVNs can draw blood and work with IV medications. However, let's make one point clear. You need to look at your state's Nurse Practice Act.
Correct.
Right? Because here in California, where JG and myself are very blessed to live in, because it's gorgeous here, guys, SoCal, woo! We welcome you to come visit us. Anytime. So here in Southern California, well, in the state of California, LVNs can do IVs, IV medications, and draw blood only when they've had a course that has given them some required information that's been dictated by the BVNPT, the Board of Vocational Nursing. And then once you take that course here in California, and your name is then certified by the BVNPT to do so. But again, that could be very different in other states.
Correct. And to add to that, whereas the LVN needs the certification, the RN does not need the certification because it's already included in our training and curriculum.
Yes.
So that's one of the big differences.
Excellent. Yes.
Another difference is that with the LVN and the RN, LVNs with certain tasks, they're required to work with a physician or work with an RN.
Yes.
For instance, when you're administering immunizations, you can administer immunizations as long as you are working with an RN or with an MD.
Yep. Correct. Absolutely. Another area is wound care. Right?
Yes.
That's another area. Wound care, again, kind of falling back on the assessment differences between the LVN and RN that we were mentioning a few minutes ago. When it comes to the wound care, your RN is doing the assessments of the wound, right? They're evaluating. And then coming up with a plan of care for that wound. And then the LVN is going to implement the plan of care, right? So you're gonna, the LVN can do the tasks involved in wound care dressings and treatments, right? And then you're gonna also continue to monitor the wound, reporting back any findings to the RN, right? So that's another area where the assessment comes into play with wound care, right?
Right. That's a good idea. I mean, that's very good information.
I think so.
And so, JD, let's put this into a scenario, right?
Okay.
So that we can understand how we work together.
Yes.
So if I'm the LVN and I'm taking care of a patient, and maybe I realize that my patient is hypotensive, meaning they have low blood pressure. And so I collect that data and I bring that information back to you, who is the RN.
Okay.
What do you as the RN do with that information?
Yes, absolutely. So then my responsibility, having JG as the LVN come to me and tell me, you know, Jessica, the blood pressure is really low. He's not looking so great. He's complaining of lightheadedness, etc. Now, me as the RN, I go in and I do further evaluation. I'm taking into consideration patient's meds, health history, current medications, right? INOs, right? Intake and output. I'm looking at a variety of things as the RN. I'm responsible to evaluate all these avenues and then come up with an idea of what potentially might be happening with this patient and then coming up with what we need to do. What are we going to do about it, right? And so in that case, that's where the LVN and the RN now start working together in taking care of that patient. So as the RN is trying to come up with the plan and what are we going to do about it, the LVN is working along with that RN to implement all of the ideas that we should be looking at. Maybe the LVN can give some input as far as some of the things that has been done for this patient in treatment plan that might need to be considered as well as far as developing that plan of care. Right? And so then they work together to take care of that patient and improve that patient's outcome.
So to me, it sounds like that you're telling me that while the RN is formulating the plan of care, I, as the LVN, am not only going to help you work together to formulate that plan, but I'm also going to continue monitoring that patient and assessing that patient, looking for any further declining in that patient, while the RN continues to do the plan of care and look at all of these avenues on the back end.
And then while this is happening, then I'm the RN calling the physician, right? And any other doctors that might be involved in that patient's care. And I'm communicating with them while the LVN is managing the patient, treating the patient, right? Doing assessments, monitoring, collecting data. That's a great scenario. I like that.
That is. I really like that too. I hope that kind of helped you guys put that aspect together. So while we've talked about the LVN and the RN difference, let's talk about what's the pros of it being an LVN before going into RN, because I think that's a big difference is that people just think that, oh my gosh, I just have to be an RN first, but there's some pros to being an LVN first, right? So let's talk about some of those.
So JG, you said it. It's not, you don't have to run out and go invest in an RN education right off the bat, right? If you have no nursing experience, the LVN is a great way to break in, right?
Yes.
There's anyone who wants to be a nurse to start out as an LVN.
Yeah.
There's nothing wrong with that. You know why? What are the pros? Pros include, number one, you get to get right into the workforce and start working and making good money from the start, right? So as an LVN, you will make good money. Go and be an LVN, and we'll talk about what that education pathway looks like here shortly. But you can go be an LVN right away and then start working and making good money and start making a difference in people's lives, already becoming a member of the team.
Yes,
right?
Absolutely, absolutely. Also, a good way to, another good reason for being an LVN is that you get to gain the experiences working with patient care. That's a big deal. We see a lot of people who come in as RNs because remember, JD and I have worked with new grads in our career, and we see a lot of people come in who do not have any healthcare experience. So being able to go in and get that experience working with patient care is a really good foot in, and it also gives you the opportunity to build your communication skills.
Yes, which is so critical.
Yes, it's so critical. Communication is so important when you're in healthcare. So being able to work on those communication skills, working with the RN, working with your physicians, working with your support staff, you get to build that communication skills.
Yeah, that's so critical and important. You know, Judd, we should do an episode on communication and healthcare teams. So stay tuned for that.
Absolutely.
But, you know, here's another great point to becoming an LVN first before you become an RN. You get to explore all the opportunities that nursing has to offer because, guys, there is so much nursing offers, right?
Yes.
So for those of you watching this video right now who are either in LVN school or have just become LVNs yourself, are new to the job role, there is so much.
Yes.
I mean, like a world of jobs for nurses in on so many levels, in so many aspects. So when you go in as an LVN, you get to start exposing yourself to different types of nursing. So you can identify where you really want to hone in on. Do you want to be an ICU nurse? Do you want to be an OR nurse? Do you want to be an ED nurse? Do you want to be a case manager? Do you want to be an informaticist? Do you want to be in infection control? Do you want to be in quality? Right? I mean, there's just so much you could do as a nurse. So as an LVN, you get to start right away, start exploring your options in nursing so that if you decide you want to continue moving forward and you want to go get your RN, now you know the direction you want to specifically go in.
Right. And all of those specialties that JD mentioned hire LVNs.
Yeah.
They all hire LVNs. So it's not just limited to working in acute care or long-term care, indirect patient care, for instance, case management. So there are there's opportunities in all of these skills and all of these positions. So if we look at all of this and we look at all of the opportunities that's out there and we decide to become an LVN, why would I decide that I want to transition to an RN?
I mean, there's lots of, because what's going to happen is when you finally have kind of exposed yourself out there in the workforce as RN, you open up many more doors to your work.
Yes.
As an RN, you'll have increased opportunities in leadership roles, in other areas and departments that you might have interest in.
Yes.
Your scope of practice will be widened. And, your salary will just keep going up. Right? So that's another great reason for going in from LVN to RN, right?
Yeah.
So it's a great opportunity. It's a good thing, transitioning.
It is. Right.
Yeah.
And so, talking about the transition, talking about LVN, talking about RN, we're all, time is valuable, right?
Yeah.
So we all want to know how long it takes to do these programs.
Yeah.
So, your LVN, if you're interested in becoming an LVN, most programs take about 18 months, right? So if you're one of those people who ready to hit the ground running, you need a job today, you need to get out there and, get into the healthcare LVN program, it's for you.
Yeah, absolutely.
And then their RN role it's about 24 months, okay? And you come out with an associate's degree. Bachelor's degree is a little close, yes. However, you come out with their RN degree.
Yeah. So again, lots of opportunities out there for LVNs today.
Yes.
Home health, occupational health, infection control, long-term care, acute care, pre-op day surgery, ER, work in a doctor's office, pediatrics. They're all these jobs are out there right now. Everything is out there for an LVN right now.
Everything is out there.
I'm telling you. So you know, think about it. If you're in LVN school now, pat yourselves on the back. You're doing an excellent thing by having chosen that. Go explore the world of nursing as an LVN. Work with your RN in a team approach. You guys are in it for that patient together. It's not one versus the other. You're together. Your patient needs both of you. We can't do it alone in one person, right? So it's good to have it together. And then kind of explore what areas you want to get into, right?
Yeah.
What else, JG? Anything else we can say for our friends in the LVN world and the RN world who's watching as well? Because RNs, by the way, I want you to take this message and take it as, okay, how can I partner with my LVN to do the job that we're doing with our patients, right? So if you're an RN watching this, think about this. These are the things that your LVNs are able to do for you. This is the kind of partnership you should be developing with your LVNs, right? So, I don't know. With that said, JG, anything else?
No, I think that we summed it up. I think our biggest takeaway from this is knowing that the LVN and RVN, we work together. We're a team. When we work as a team, at the end of the day, it's about the patient, and we have better patient outcomes when we work together. So we're all nurses. We're all in this for one ultimate reason. Well, probably two if you count money, but but we're in it to help our patients, and so working together is what's important.
Yes.
So until next time, guys, I'm JG.
And I'm JD.
Bye.
Bye.